Hello. So I wanted to give you just a little bit of an idea about what to expect in your first therapy session. Now this will vary a little bit per therapist and how they kind of set it up, but overall these are like a couple things that are pretty standard that you'll experience. So if you're walking into session and you're not quite sure what to expect, want to give you a little bit of an idea, some heads up. So for the first session, it's a lot like a normal first doctor's appointment. There's the gathering of your history, your contact information, emergency contact, kind of if anything significant has happened in your life, any concussions, any specific traumas, any your relationship status, your family of origin, kind of things like that, just to get a kind of sense so we know where we're starting from. You are under no obligation to tell your deepest, darkest secrets or go straight into your trauma right away. You have every right to go into that at whatever pace you feel comfortable. Remember, you're figuring out if you want to keep seeing this therapist. The therapist is figuring out if they're the right fit for you and how they have the right thing to offer. So some things that we always go over in the first session are confidentiality. In therapy, anything you say in the therapy room is completely confidential. Nothing will be shared with anyone. There are a couple exceptions to that, given that we are mandated reporters, which means we are mandated by law to report certain things. Those being if anything comes up in session about child, elder, or dependent adult physical or sexual abuse. Those are things that we have to call the police and have to report. Most therapists will discuss this with you if that comes up and if it needs to be a report needs to be filed. It is a big thing in therapy to be able to process that. Another is if you have any intent to hurt yourself or to hurt somebody else, that is something that we legally can break confidentiality for, and that may consist of just calling your emergency contact and letting them know, hey, we've got some concerns, can you keep an eye on them, or encouraging you to share that with your emergency contact so it's not something you have to hold by yourself. Because we just want you to be safe. That's the whole goal of all of this, is just to make sure you're safe and that you have resources available if you need them. There's usually a cancellation policy, a no-show fee, what the rate is going to be for a session. I'll have another video about paying and rates and all of that and what to prepare. But really, it's a basic a jumping off point. So therapist gets an idea of what's going on with you and what direction it might go, but also so you get a sense of what that therapist is going to provide for therapy. So I always explain a little bit about how I work, what my goals are, how I do therapy, so that you as a client also have the choice to choose if you want to work with me. I'm not the therapist for everyone, and that's okay. So I'll go into my little spiel. I'll probably do another video on that for you. But just to get an idea of what you're in for, I usually tell people that I like to meet weekly for at least the first 6 weeks, so we can see if we get momentum going, if we get into the meat of what's going on and you start to see some progress. Now, nobody can tell you how long therapy is going to last, or how long you need to or should be in therapy. That varies case by case, situation by situation. Sometimes we can go every other week. Sometimes we get to a point where we can do monthly check-ins, and that just all varies. But I would plan on going weekly to therapy for at least minimum 6 weeks to get an idea of what's going on. That's kind of where I start with that. We may finish session with setting a couple goals, and I like to have that be client driven. What do you think you're capable of this week? What do you think is most important to start changing? And something that's attainable, something that you're like, hey, I know that I can do this. I know that I can, make it to the gym 1 time this week. I'm not going to ask you to go 5 times because please, who does? But hey, if you can go 1 time, or if you can put your sneakers on, we set attainable goals so you have an idea that you're able to track that you're moving forward and that you're making progress. So that's kind of in a nutshell what a first session might entail. So meeting the therapist, going all over your basic information, going over some of your history so the therapist has an idea of what's kind of going on in your life, kind of saying what you want out of therapy, going over what treatment might look like, and then setting some goals. So, like I said, everything can vary. Therapist by therapist is all a little bit different, but for the most part, that's what it'll look like. If you have any questions about going to your first session, what to expect, if you have a question about it, feel free to private message me. Feel free to leave a comment. I'd love to get some interaction. All right, take care.